Hello everyone. I have been an ardent follower of Ms. Palki Sharma and the value that she brings to our table. Thank you so much, Palki, for addressing one of the biggest concerns in healthcare today, antimicrobial resistance, AMR. As a medical microbiologist with nearly 18 plus years of experience in the domain of infections and being a close observer of the healthcare ecosystem of our country, LMICs in general, and the developed world, what I think is what was once claimed a silent pandemic is now a blazing forest fire. And we need to not only take cognizance of it, but actually do something about it. Contributing to nearly 4.95 million deaths globally and threatening predictions for 2050, what concerns me is the fact check of our current state. While with the continued surveillance efforts of the Indian Council of Medical Research, we do get a glimpse of the increasing burden of resistant infections, now very much beyond the walls of hospitals. They have forayed into the community as well. What we know is probably just the tip of the iceberg. The One Health approach drive in AMR, being propagated by national and international bodies, have evidenced and emphasized the diverse contributors to this growing menace. Right from the rampant use, misuse, overuse of antibiotics due to empiric therapy, which is an obvious outcome of the limitations of current legacy-based diagnostic methods in microbiology, to indiscriminate use in other sectors like farming and animal husbandry. Contributors are enough. Now, in the face of this crisis, while a number of solutions have been proposed, and we are waiting for the delivery of the same, right from the allocation of enough research funds and the development of novel antibiotics or modalities of therapy for resistant infections, while we are trying to bridge the gap between formulating policies and actually implementing it on ground. What I see as an immediate call to action, which is feasible, which is doable, and which is urgent, is to have an accessible and affordable diagnostic solution for everybody across the globe. Now, I could sense this urgency of leaping from an empiric based therapy to precision based medicine in infectious diseases. I could realize it when I joined hands with Haystack Analytics, a homegrown health tech based company, where we could design a solution with applicability across the globe. A solution for detection of infections, a make in India which is powered by the most advanced technology, next generation sequencing, which is a single test solution for the country, which is available to the masses in a very cost effective manner, which can empower healthcare to not only diagnose infection and improve the quality of medical microbiology delivered to the patients, but also improve patient outcomes in the process, reduce hospital stays, decrease healthcare costs incurred, prevent the economic burden that we all know of, and in the process combat the threat of antimicrobial resistance. What we really need to understand, acknowledge, and remember is that the first step to an efficient antimicrobial stewardship, to effective use of antibiotics, a tailored use of antibiotic, is accurate, fast, and hypothesis-free pathogen identification. I open this forum to all the stalwarts across the healthcare domain. I invite medical microbiologists, infectious disease specialists, critical care experts, and more to share your opinion, to debate, to discuss, and to come up with your ideas. Signing off for now, this is Dr. Mahua Dasgupta, Director Medical Affairs for Haystack Analytics.